Welcome to this week's edition of the Ozarks Medical Center Medical Minute. We are once again joined by J.J. Corman and Mandy Pender, and today we continue our ongoing theme of the holidays. This week, let's talk about when it's time to go to the emergency room.
Well, so we mainly see an increase in fevers this time of year, especially during the holidays. We all get together, we spread our germs of love, and we also spread the flu and viruses.
Our elderly patients and our young patients kind of have a hard time fighting off flu and different viruses, so we're going to see them more often than our middle-aged or normal-aged patients. So if we are an infant that's been running a fever, if you're less than 3 months old, if they're running a fever, they need to come to the emergency room immediately. If they're over 3 months old, then we start looking at how long and how high of a fever should they be coming.
Are they making wet diapers? If they haven't made a wet diaper in 6 to 8 hours, they need to go ahead and come into the emergency department. That baby's probably getting dehydrated.
We also stomach bugs either because of food poisoning or bugs going around. That's a big common cause for people to come to the emergency room. Nausea, vomiting, diarrhea. So if you're unable to hold anything down and you're unable to urinate within 8 to 10 hours, we probably need to be seeing you if you're an adult.
Because you might need IV fluids.
Yeah, and it might not be an overnight hospitalization. We may be able to give you some IV fluids in the emergency room and send you home, which would be the best of both worlds. Another good reason to come to the emergency room are burns and lacerations over the holidays. We're going to be cooking a lot in the kitchen, little ones in the kitchen.
You're going to be reaching up, getting up on the stove, or blowing out candles that you have lit around your house. You need to make sure that your babies and your kiddos don't get burns. If they do get a burn, don't put cold water or ice, warm, tepid water on that burn. If it's larger than a quarter, oftentimes it needs to be seen. So if they've hit the flame, if they've had their hand, a palm on a burner, that baby or a child needs to be seen in the emergency department because that affects your hands. And so that's an important place to really be checked out and make sure that that's going to be okay.
Also want to think about things like dog bites. Anytime a dog punctures the skin of an adult or a child, we need to come to the emergency room, make sure that's good and cleaned, and then possibly get some antibiotics.
We see a lot of infections in those hands and fingers whenever we get a dog bite or cat. And of course, we're around different animals during this time of year, and they're unfamiliar with us. They might be a family pet, but they're unfamiliar with some of our kiddos.
Another reason to come to the emergency room is our ATV accidents. A lot of times the weather gets nice over the holidays. We're all together. We get to ride in the ATVs.
We get a four-wheeler for Christmas, and we have an accident. So any kind of head injuries, ATV accidents, you need to go ahead and be seen and checked out just to make sure your head and your neck is okay.
Ladies, once again, thank you for joining us for our Ozarks Medical Center Medical Minute for this week.